Hi, my name is Rachel Walkup. I'm here doing my head-to-toe assessment for health assessment. This is my patient, Melissa. Before we walked in the room, I had Melissa empty her bladder. I had her put on a clean gown. I checked her visual acuity with the Rosenbaum for near vision and the Snellen chart for far vision. Both were 20/20 with her corrective lenses. We checked her vital signs and her height and weight, which were all within normal limits. I washed my hands before beginning this exam, and now here we are. Hi, Melissa.
Hi.
Hi. So I'm going to start by just inspecting the skin, inspecting her head for symmetry. So her ears, her eyes look symmetrical, her skin looks normal, or her skull looks normal cephalic. I'm going to palpate. Any pain with palpation?
No.
Okay. So no tenderness noted, no masses noted. Her hair has normal texture, no dryness noted. So then the skin looks even color, normal for ethnicity. I'm just visualizing the hair distribution for your eyebrows and your eyelashes, which both look even. I'm now going to look in your eyes. So right now I'm just looking for the sclera, which is white. Her conjunctiva is pink. No injection noted. The same with her left eye as well. Her pupils are equal round and they are reactive to light. If I were to do an eye exam, I would use my right eye to Melissa's right eye. I would visualize the red reflex, and when I see that, I would move in. Perfect. So I would do the same thing on the left side. Left eye to left eye, looking for that red reflex, and then moving in. All right. I'm also going to palpate your lacrimal apparatus. I'm going to have you move your glasses up first, sorry. Any pain with palpation?
No.
Okay, no discharge noted either, which is a normal finding. I'm going to look in your ears. So first I'm noting symmetry, which her ears look symmetrical. Any pain to your auricle?
No.
Okay, no pain there either. Okay, so I'm going to look inside your ear, going up and back. So looking for that tympanic membrane, which is nice and gray, pearly. No bulging noted, which is good.
Great.
All right. I am going to look in your nose, so I'm going to have you lean back just a little bit. So visualizing that septum doesn't look deviated. Your nose looks symmetrical. I'm going to check your patency. So if you'll occlude your left nostril and breathe in and out. Perfect. And then do your right nostril. Perfect. So her patency is good with both nostrils. Your turbinates were pink and moist. Those are all good things. I'm going to have you open your mouth. So first I'm looking at her lips, which are moist, not dry, symmetrical. That buccal mucosa is pink and moist. Her tongue is pink, symmetrical. The back of her throat, the pillars are not red. The uvula is midline. Tonsils are 2+. And if you stick out your tongue, move it side to side, and then up and down. So their hard palate and soft palate look intact, which are all good. All of her teeth are ivory. I don't see any dental caries, and all 32 appear present. All right. Now I'm just going to palpate, okay?
Okay.
So your frontal sinus, any pain here?
No.
Maxillary sinus. Okay, now your TMJ, I'm going to have you open and close. Open and close, okay. So no clicks or grinding felt, which is a normal finding. I'm going to palpate your lymph nodes. So we're going to start occipital. Any pain?
No.
Post-auricular, pre-auricular, tonsillar, submandibular, submental. So superficial cervical chain, posterior cervical, deep, supraclavicular, infraclavicular, and I'm going to feel under your arms for your axillary. Okay, any pain with that?
No.
Okay, perfect. I'm going to have you move your head from side to side, checking range of motion in your neck. I'm also going to have you push against my hand, perfect. Push against my hand. Okay, so neck strength is 5 out of 5, which is normal finding as well. All right, I'm gonna have you do a couple tests, a couple silly things. I'm gonna have you clench your teeth. I'm gonna have you stick out your tongue, smile really big, puff out your cheeks, squint your eyes closed, and then wrinkle your forehead. Okay, perfect. So 5, 7, and 12 cranial nerves are all intact. I'm also going to test your sensation on your face. So I'm using a cotton tip applicator. So this is soft and this is sharp.
Okay.
So I'm going to have you close your eyes and tell me which one you feel.
Soft. Sharp. Soft. Sharp.
Okay, good. So cranial nerve 5 is intact. I'm also going to check your gag reflex. So first I'm going to have you say ah. Perfect. So cranial nerve 9 and 10 are also intact. I'm going to have you shrug your shoulders. Good range of motion, any pain?
No.
Okay, and then push against my resistance. Perfect. So cranial nerve 11 is intact. All right, just a couple more tests. So I'm going to look in your eyes for any strabismus. So I'm going to cover your left eye, and then I just want you to look at the tip of my nose, okay?
Okay.
Perfect. None noted there. And none in your right eye either, which is good. All right, a couple more tests.
Okay.
I'm going to have you cover your left ear, and I'm going to whisper a word behind you, and I want you to tell me what you hear, okay?
Okay.
And so this is the whisper test. It's testing cranial nerve 8. Apple. Okay, so cover your right ear.
Tuesday.
Perfect. All right, and now I'm going to do a test called the Rhine test. This is also testing that cranial nerve 8. I'm going to touch this to your mastoid bone. I want you to tell me when you stop hearing the sound. Stop hearing the sound. I'm going to move it to the front and tell me again when you stop.
Okay.
Okay?
Okay.
Okay. Okay. Good. So air conduction was greater than bone conduction, which is a normal finding. All right. So now I'm going to take a quick look at your neck. Trachea looks midline. Thyroid is not noticeably. No masses. Any pain with palpation?
No.
Okay. I'm also going to have you lean back, extend your neck a little bit, and swallow. Perfect. So feeling that thyroid move up and down, which is a normal finding, and it moved really well up and down. Okay. I'm going to feel your carotid arteries just one at a time, which I feel nicely, 2 plus. Two plus as well. I'm going to listen. I'm going to listen with the bell of my stethoscope, and I'm going to have you hold your breath. Okay, no fluids heard. Again, no breweries heard, which is normal. I'm going to listen to your thyroid as well. And nothing heard there, so, which is a normal finding. Okay. I'm going to have you follow my finger with just your eyes, checking your visual fields. Okay?
Okay.
So just follow my finger. And I'm noticing a smooth transition in all of these visual fields. I also want you to close your right eye. I'm going to hold my fingers up, and I want you to tell me how many fingers I'm holding up.
Okay. 2.
Okay?
3.
Okay?
2. None.
Okay? So now I'm going to have you do your other eye.
2.
Okay?
3. 3. 2.
Perfect. Perfect. So just checking your eye movements. All right. So now I'm going to move on to your upper extremities. So just visualizing for color and symmetry, which your color is good, dry, warm skin. I'm going to check your cap refill. All right, less than 3 seconds, which is a normal finding. I'm going to check your pulses. So radial pulses, 2+, brachial pulses, 2+. All right, I'm going to use my reflex hammer. Okay. Checking that brachial tendon, that brachial reflex. Perfect, and 2+ as well. So I was feeling her pulses first, and then I checked your reflex, which are all normal. All right. I'm gonna have you turn to your left, and I'm gonna start with your anterior chest. So really visualizing for labored breathing, even respirations, looks symmetrical. I'm going to just kind of watch her respiratory efforts. No accessory muscle use noted. No pulsations noted. No thrills. I'm going to palpate. So really feeling that chest wall and precordium. No pulsations or thrills or heaves noted. Okay? I'm going to do some tactile fremitus, so I'm going to have you say 99. And what I'm feeling for is even vibration throughout all lung fields. So say 99.
99, 99, 99.
Perfect. And while I'm here, I'm going to feel for her apical impulse down at this 5th intercostal space, mid-clavicular line. I'm having to go left a little bit, which I do feel, so that's a normal finding. All right, I'm just going to percuss and listen through your lung fields. I would, of course, do this on bare skin. Listening for resonance, which I do hear. Okay. And now I'm going to auscultate. So really listening from side to side, having Melissa take deep breaths on bare skin as well. So listening to lung sounds first. Perfect. I don't hear any wheezing or crackles. I hear clear lung sounds through all fields. I'm now going to listen to your cardiac points. So starting with the aortic point, pulmonic, Erb's point, tricuspid, and mitral. And S1 and S2 were heard with no murmurs, so that's a good normal finding. All right, I am going to have you turn around so that we can see your back. So again, inspecting the skin color, no masses noted, even skin color, consistent for ethnicity, warm temperature, but very symmetrical, which is what we're looking for. I'm going to percuss her lung fields posteriorly as well. Listening for resonance. I'm going to percuss laterally as well. Perfect. Okay. I'm going to check for CVA tenderness. So this shouldn't hurt, but just tell me if you're feeling anything.
Nope.
No pain?
No.
Perfect. Okay. So now I'm going to check her the symmetry when she takes a breath. So take a deep breath in. Perfect. And so my hands move symmetrical, so I'm seeing even expansion, which is what we want to see. So I'm going to check tactile fremitus in your back, so that same 99. I'm going to have you say that over and over until I ask you to stop.
99, 99, 99.
Perfect. That was good. So really hearing or feeling for vibrations evenly throughout all fields. Now I'm going to check for your diaphragmatic excursion, okay? So I'm going to have you take a deep breath in, blow it all out, and hold it. Okay? So palpating until I hear that dullness, which I do. All right, you can breathe normally. I would mark that on our skin. And then I would take a deep breath in and hold it. So palpating down again until I hear dullness to kind of hear where that diaphragm moves. So a normal finding is 3 to 5 centimeters. Melissa is right at 4, which is normal. So you have normal diaphragmatic excursion, so that's good. I'm going to listen. I'm going to auscultate your posterior lung sounds, so just take deep breaths for me. Listening side to side. I'm going to listen laterally as well. And really comparing those findings side to side. And I hear clear lung sounds. I don't hear any wheezes or bronchi. So a normal assessment. All right, I am going to have you lean back. I'm going to have you stay at 45 degrees for just a second so I can visualize your jugular vein distension. And I don't see any, so that is good. All right, so I'm going to lay you all the way back. Okay. I'm going to pull this out for you. There you go, sorry. Thank you. Grab my stethoscope. So first I'm going to visualize Melissa's abdomen. I would visualize bare skin, so really noting for pulsations, any peristalsis that I see. She's non-distended, so all good findings. Second, for abdomen, I am going to auscultate. So listening in all 4 quadrants. And I do hear normal active vowel sounds. So while I'm here, I'm going to flip over to the bell and listen for arteries. So listening to her aortic artery, renal arteries, iliac, and then femoral. And no turbulent blood flow noted, and no bruits. So that is good. Now I'm going to just do some light palpation. And tell me if you have any pain with any of this. Okay. All right. I'm going to percuss as well. Okay. So listening for tympani and all of these bowel areas, that air-filled sound, which I do hear. While I'm here, I'm also going to measure your liver span. Perfect. So let's measure that liver border. So I'm going to start in an area of tympani, and I'm going to percuss up until I hear dullness. So I'm going to mark that, and then I'm going to start from the area of resonance, these long sounds, until I hear dullness as well. I'm going to measure that. A normal finding is 6 to 12 centimeters. And Melissa's is right at 7, so that is normal. All right, so continuing with some light palpation, really feeling for that spleen on the left costal margin, which I don't feel, and that's a normal finding as well. Palpating deeper on this right costal margin, feeling for the liver, which I do feel about a centimeter below that right costal margin, which is normal. Palpating your kidneys, which I don't feel. And just looking at the normal musculature, which your abdominal musculature is normal. When I was percussing on this left side, I didn't hear any splenic dullness, so that is a good normal sign. And then just really looking at for aortic pulsations in this middle, which I don't see any. So that's a good finding.
Good.
All right. So I'm going to have you sit up again. Actually, I'm going to have you roll over on your belly, and I'm going to do your Achilles reflex while we're here. Just hang. Perfect. So 2 plus reflex, which is normal. All right. So I'm going to have you sit up for me. I'm going to put this down. Okay. So now just really looking at her legs, looking at the color of her skin. Put this down. The color of her skin, which is even, the temperature is even and warm. No edema noted, no gaping wounds, nothing that I can see here. So feeling for pedal pulses, tibial pulses, and then her popliteal pulses. While I'm here, I'm also going to check her reflexes. Perfect. Perfect. Awesome. Okay. I'm going to check your muscle strength while we're in this position. So I'm going to have you push against, perfect, and try and pull your legs down. Okay? Same with your arms. So hold your arms out. So push up against me and then push down against me. So equal strength, 5 out of 5, which is a normal finding. I'm going to have you stand up. Just a couple more things in our assessment. So I'm going to check Melissa's spine for extensions. I'm going to extend your lumbar spine back, flex forward, perfect, and then rotate side to side. So lumbar spine looks good. Let's do your cervical spine. So extend your neck back, flex it down, move side to side, good rotation in that cervical spine. Perfect. I'm going to have you do a squat, just looking for symmetry. Perfect. Good. Any pain with any of that?
No.
Okay. So thank you for watching my physical assessment. And Melissa has a
Thank you.
normal physical assessment.